Hey guys, so we're back with part 2 of the answers to the questions that you guys asked. I hope you're doing well. So part 1 was about answers and questions for doing masters in general. So things like, how can you apply for a master's? What master's should I apply for? Things like that. Can you work while you're doing a master's program? So if you've not seen that video, or if it pertains to you or somebody you know, please go back and look at the previous video. Now, so again, we're answering questions from a list that was accumulated through a poll on Facebook, and we came up with about 15 questions. I'm still going to put the questions up again very, very soon when I share my screen. But I've just grouped the questions into about 4 groups. So there's going to be about 4 videos in this series, hopefully. The first one was on masters. The second one I'm going to talk about now is going to be the medical students options and PLAB. Then there's going to be another section on post-PLAB, things you can do after PLAB, GMC registration, all of that. And then there's going to be a final video dedicated to the foundation year 1, what's called the FY1. A lot of people refer to it as residency, but it's called the foundation program in the UK, or training, not residency. So yeah, so let's just kickstart this one. We're going to be talking about the medical students, options for medical students, and PLAB exams, okay? So let me share my screen again. Where was this? So again, we'll go back to those questions from the notes. Let's start from there. Okay. So now we're going to be answering questions 6 and questions 14. So question 6 said, for me, I need to know the options available to international medical graduates and steps towards achieving a medical career. First of all, if you're already a doctor, that is pretty much the first step in your medical career. So let's just assume we're starting from after there. So options available to you. Now, in life, I believe that there's most things occur in the gray zone, in the gray area. So you need to know what you want to do, right? If you're looking for somebody to tell you what to do, I'm probably the wrongest person to ask, but I'm just going to lay out options for you so you see what works for you. Now, as a medical doctor, there are a lot of things you could do in your life right now that you're a doctor. But everybody knows that if you want to practice, the first thing you need to do is your internship. If you finished from Ukraine, before now, our final year was considered as pre-graduate internship. But especially for those of us, I think actually the whole of the Ukraine, it was sort of disregarded a little while ago. So now you still need to do another internship after that. So if you want to practice, that's your first option. You need to do an internship. There's been a lot of questions I've gotten about internships. So I'm just going to see if I could just sort of summarize, because I would still talk about that in the FY1 video. So internship basically is the compulsory 1-year training you undergo after you graduate. If you're not a medical person, this is probably jargon to you, but we have to do an internship. It's called different names in different places. In Nigeria, I think it's called a house job. In the UK, it's called the foundation training. So foundation year 1 is your internship year. In some other places in the EU, it's done as part of your training, right? So it's different names in different places, but it's just generally a year or 2 in some places where you work under supervision before you're given a full license to practice. Okay, so that's your first option. You want to do clinical practice, you have to do an internship. So we're going to talk about the internship bit in regards to the UK when we come to the FY1 video, so just stay tuned for that. But yeah, that's the first option. You could do that wherever, however you want to do it. So a lot of people do it in their home country. If you're allowed to, you do it in the country where you had your medical school in. But not everybody gets that opportunity, especially if you are in a country where maybe they don't speak English or the rules just don't allow. So yeah, internship, that's your first option. Now, for a lot of other people who don't want to practice, they go through the academic route. So you do your master's, you could do a PhD, you could start working, right? Personally, I did my master's and I started working in something else. I mean, I don't want to go into details in my personal life, but I have done other jobs and I've also had clinical practice, if that makes sense. So you just do what you want to do. There are a lot of options. Now, for some people, you might decide, okay, you know what, this medicine thing is not for me. I don't want to practice. But you already have that medical knowledge. So there's a lot of stuff you could do. You could apply yourself in many ways. You could outrightly leave medicine and go and do what you like. I know some people that are into fashion right now and they studied medicine. If you're somebody who maybe you're forced into medicine, you might not want to continue, maybe even find yourself, right? But if you're somebody that just, you know, wants to integrate medicine into other things, there's a ton of options. I had this consultant that I met, and he advised me that I should always remember that there are other places that I could apply my knowledge to. So he talked about maybe, I love psychiatry, and that's what I'm hoping to specialize in. So he was advising me on, you know, opportunities in psychiatry outside the hospital. So you could just, you know, find what works for you. If you're somebody that's good at teaching other people, you could decide, okay, you know what, I'm just going to do some academic postgraduate course, maybe a master's or a PhD, and start teaching. If you're somebody that, you know, is more into business, you could look at the business side of medicine. So maybe do some training, liaise with pharmacies, liaise with business people, etc. I'm not going to give you all my tips. You're going to pay me if you want more information. So I'm going to stop there. But my point is there are many ways you can apply yourself. Now, another route you could decide to go through, like I already mentioned, is you could leave altogether. But then if you want to achieve or go through a medical career, which is what she's asking or he's asking him, not sure, the steps towards achieving a medical career, you want that, I would take it that you probably mean practice. You need to do your internship first. Then depending on wherever you want to work in, if you want to work in the UK, as somebody who studied abroad, you need to take the PLAB exams. If you want to work in the US, I think they don't do an internship. They just sort of go straight in. You said, but you write the exams too. Canada, it's a different procedure. Everybody has their own, you know, process. So do a little research, ask questions from people who are already there. If you have some specific questions that this video doesn't answer, which I hope will not be the case, then reach out to me. But yeah, so I think those are some of the, just broadly, the things you could do. So you could start practicing as a clinician, you could, you know, do some training, go academic, teach others, you could go into research again. So there's a lot of options. So you pick what works for you, you pick what's most feasible, and just be true to yourself and pick what you like. You have only one life to live. Don't allow somebody to dictate, you know, how you're going to live and spend the rest of your life. Misery, in this case, is not going to have company. They're going to be miserable alone, right? So do what you love. And yes, one other thing I think I should just say here is that, see, medicine can be a scam. In the fact that nobody really told us from the beginning, all those people that are pushing us going to medicine, well, nobody pushed me anyways. But I know a lot of people that know that were kind of pushed, and nobody told them that, oh, when you finish the 6-7 years, you're just starting. Like, you have just begun, that you need to do internship and all of that. So, if we knew, look, most might not have done medicine, but you just start the journey once you finish medical school. But congratulations on graduating and getting there. Now the world is your oyster. So do what you want to do. If you want to practice, try to get yourself into an internship as soon as you can. Get registered and start applying for jobs. Another good thing about also doing your internship is you're probably going to be more exposed to, you know, other conditions and areas where you could work. In the UK, for example, at a point, I kept getting a lot of messages from people on LinkedIn asking me, oh, do you want to be, you know, do you want to locum for us? Do you want to be a functional assessor? These are like companies that are not necessarily even medical companies, maybe not even hospitals, but they just need a doctor figure there, right? So like I said, I'm not giving you my secrets. This is a bit. But yeah, apply yourself in whatever works for you, okay? So I think that question has been answered. So as an international medical graduate, depending on what you want to do, you take the appropriate steps. Question 14 is another question in this section, which is it possible to come there straight up and do my specialization? Straight up meaning in the UK. So depends on where you're writing from. So let's assume she's writing from Ukraine. If you're in the Ukraine, if you're in, I keep saying the Ukraine, I'm sorry, I've stayed here for too long. If you're in Ukraine, you cannot come here directly if you don't have the right to work. If you do have the right to work and the right to live, so you're a permanent resident, you're a dependent, you know, of some kind, you're a citizen, nobody's stopping you. You come straight away and you fall in line, basically. But if you don't have any of these things, as of now, and as of what I'm aware of, it's not possible. So you need to go to somewhere else and then come back. And the way this thing even works, even if you have a, what's it called, a visit visa, you can stay here and write your exams. But when you want to start working, you still need to switch your visas. That makes sense. That's a whole process altogether. But short answer, no, you can't come straight away. Short answer. So the specialization. So specialization, like I said, it's called training. It's still pretty much the same thing. Potato, right? But you need to have done your internship first. If you're going to be, if you're not in the UK. If you're in the UK, you should have done your foundation. You should have had full registration, basically. So you must have at least done your FY1. If you're going through the full program, FY1, FY2, and then you can apply for training. Now, you could go into training. There are different levels of training. You have core training, then you have specialty training. So you're different things at different levels. You're junior doctor, then you're junior reg, you're reg consultant, all of that. So again, those are different steps. But short answer, you cannot come here directly to do your specialization. And to do your specialization and to get into specialty training, as it's called here, there's some steps depending on the specialization you're going into. Right now, the shortest route is GP training. It takes only about 3 years. So let's say you'd already gotten your internship in Nigeria, you've passed your PLAB exams, you would then apply for the GP exams, pass it, and then get into GP training. And in 3 years, you're a consultant. Okay, and that applies, it's different for different specializations. I think that should probably answer that question. So I will just try and quickly brush through the PLAB with it about remaining time that we have, say about 4 or 5 minutes. Okay, now PLAB is the exam that you need to take if you want to you want to practice in the UK and you did not school here, right? Now, if you schooled in an EU university, chances are high that you don't need to take PLAB. Now, with the whole Brexit situation, we don't know if that's going to change. But as of now, I have classmates who just pretty much came straight away, and I was pained in a way, but it's what it is. So funny thing is, if you're British, you still have to write the PLAB. So I don't really know or understand what they did there. I don't get it. But if you are an EU citizen, as of now, you don't have to write the PLAB. That's your only way. Either that or you schooled in the UK. If you also, so if you're UK citizen, so you're an EU citizen and you schooled in the UK, you don't have to write PLAB. But if you did not school in the UK, you're writing your PLAB, as long as you're not EU. This is getting confusing. So let's break it down. If you're those who writes PLAB, number one, people who are not EU citizens and did not school in the UK. I think that's better. You're not an EU citizen, you did not school in the UK, you're taking your PLAB exam. That means that if you're British and you schooled in Ukraine or in Russia, you are still writing PLAB. You are also still taking your IELTS Interesting, I know, but you're still taking that as well. I don't know why they did it that way, because it's funny, because you come and you see somebody maybe from Spain or from Poland who you think doesn't speak English as clearly or as fluently as you do, but they don't have to do all of that. It's politics, it's the EU treaty or whatever. Brexit might change all of that, it might not, it is what it is. So you finish medical school as an international student or as a British student who wants to work in the UK, you're writing your IELTS, you're writing your PLAB. Now the PLAB exam has two parts, PLAB 1 and PLAB 2. The IELTS exam has criteria meant to meet. I think it's about, you need to get an average of 7.5 in all bands and not less than 8 across all 4. So total of 7.5 and not less than 8 or 7. I'm so sorry, I don't have all that. I have it all mixed up, but yeah, you need to pretty much pass your IELTS according to their criteria. Then you write your PLAB 1 and you pass it, write your PLAB 2, and you pass it as well, then you register. If you want to write the PLAB 1, there's many groups on Facebook. So I would have opened that, but I just wanted to touch on this. There's a group called PLAB, PLAB. So search that up on Facebook, request to join. There's a lot of people already there. So that's why you know it's the main group. There's a lot of doctors on there. So join that group. There you're going to find information about, what to use to prepare. There's a set of past questions, if you will, 1700, I think it was called. So you just have pretty much past questions to help you to sort of study and help yourself. Then there are academies you could join, and these guys help you, give you mock exams, put you pretty much in a situation to prepare you. Then you could study on your own. You could study through WhatsApp group. There's a Telegram group where a lot of people just come together and study, and all those things are very helpful. So just quick tip for the PLAB 1 preparation, read the notes. There's this guy, Samson notes, they're pretty good. I think they're still good. So read the Samson notes, practice with your heart. So put your heart into it when you're practicing, so you don't have to do it twice. The PLAB 1 is not as expensive as PLAB 2, but trust me, failing that exam stinks like hell. So just put your mind to it. It's very doable, it's very possible. And then if you think you absolutely need that focus, maybe join an academy. You don't need to, but join an academy for your PLAB 1. Now the PLAB 2, you need to take that in the UK. PLAB 1 is written in many countries. PLAB 2 is only written in the UK. So you need to come to the UK and take it. Now, the good thing about PLAB 2 is it's an OSCE. So you just really need to practice a lot and practice very, very well. Your practice is extremely important. Now, going to the academies, to be honest, I feel like it doesn't really matter. You could go to whatever academy you want, as long as you're practicing well, as long as you're really, you know the right things you're meant to be saying. So that there's a couple of things you're judged in. You're judging your interpersonal skills. So how do you treat your patients? Are you a doctor who doesn't listen to the patient? Do you not care about your colleagues? Is your nurse with you and you're just ignoring her? Do you know how to, watch out for verbal and non-verbal cues? So all those things, they're judging you on that, your interpersonal skills. They're judging you on your history taking. Do you actually know how to take history in a systematic way? So if the patient comes to you with a headache and then you're asking about, let's say, the first question you ask is, let's say, I don't know, some weird question, like maybe, did you, just something weird, right? So are you asking the important questions? Are you using your Socrates? Are you using all the guidelines you should ask? Are you asking about onset, duration, like how long? Are you ruling out other things, right? You know that you need to be a safe doctor. You need to be a caring doctor as well. So you need to make sure that if a patient comes to you with a headache, you're ruling out meningitis, you're ruling out cancer, you're ruling out maybe stroke by asking the right questions. So are you structured in the way you ask your questions, and your management? So patient has told you that, okay, he has morning headaches and they get worse maybe when or let's say headache on one side of one side of the head, it spreads down to the jaw, and laughing and stuff triggers it. You're already thinking about a couple of things. So are you asking the right questions? Are you taking an ESR to rule out gyrating arthritis? Are you taking a blood culture? Are you taking the important things, right? So are you managing this patient properly? Are you telling them that, okay, I'm a junior doctor, so I cannot tell you to go for surgery. I have to refer you to my consultant. Do you know your limits? So they're judging you on all these things in your PLAB 2 exams. So you need to go to an academy, so they give you a structure. They just sort of give you a refresher on the way it should be done in the UK and according to guidelines. But then you practice, like you smash that practice. Make sure you're practicing with good people. Make sure you're working on your confidence, your eye contact, just the way you're for them. Just be a safe doctor, be a great doctor, and hopefully PLAB 2 will be a one-time thing for you. So I think that would pretty much be where I round up today. I spoke more than I expected, but yeah, that is it about PLAB. So again, as before, if you have any questions, if you have any things that you think I didn't clear, write them in the comment section. You could meet me on Instagram. I am Amaka, NJAMAKANJ. I also have another account, momentswithsoph, moments, WITHSOPH. So that is me. Send me a message. If I didn't answer the question absolutely here, I would give you whatever I have. Otherwise, I'll refer you back here. If you know somebody who needs this video, please hit like first, share it with them. Don't be stingy with your fingers. Hit like, share, and subscribe to my channel. So I would see you in the next video where I'm going to be talking about post-PLAB questions. Have a lovely day, guys. Bye-bye. So let's stop sharing. And I'll see you all next time, okay? Bye.